The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees. Now, time for a break with Central Illinois' own Gretchen Wirtz.
Welcome back to Central Illinois Newsday. I'm Gretchen Wirtz, and today we're talking lung health with Heartland Health Services, and Thomas Hitton joining us once again. Thomas, thanks so much for joining us.
Yeah, thank you.
Today we want to talk a little bit about the Edwards grant that you guys got, and tell us a little bit of the background of where that Edwards grant, what it is and what happened.
Yeah, absolutely. So there was a lawsuit brought against the Edwards coal plant in between Bartonville and Pekin, and pretty much what happened is there were multiple organizations, environmental organizations that were a part of this, and they pretty much did a study and found out that they were putting out stuff in the air that's not good for your lungs.
Yeah.
One of the things most notably soot, which isn't good. It's one of the most common pollutants, and so they got this grant approved, and a judge said, hey, you can't do this, so we have to allocate money for different things, and one of the things was lung health. And it was kind of a no-brainer for Heartland. They were just kind of like, we're going to take this funding and we're going to impact community health and wellness in the Tri-County area.
And that's exactly what you guys are doing. So you're using the money here to do pulmonary tests, I guess, on people, right?
Yes, ma'am.
What is that test exactly, and what happens?
So it's called a PFT, pulmonary function test. And so what that does is that helps us, see a patient's lung function, and then other various lung diseases. And so we take that information and that data, and we give it to the physician, and they determine, what they feel they have. And if we think that there may be something more to that, then we refer them to the appropriate care. Okay. So they can get that.
Does someone come to you just off the street, or are they referred by their primary care physician? How do patients come to you?
So both.
Okay.
So there's a marketing team that's actually out there, boots on the ground, informing.
And this as well, yeah.
Yeah,
stuff like this, yeah.
Educating the community on what this program is. We do have primary care physicians within the organization that are, hey, I have a patient that falls within the zip code, or the impacted area, and I want them to get tested, and so they'll refer them. But also, yeah, we want patients, that are on the street that know about this to come in, and get tested, call and get tested, or whatever they have to do to come in and get screened.
And just get screened and get some answers, and hopefully get on track to improving their health. How many people have you done the screening for so far?
So we started in February, and so we screened, part of the grant was the first year we had to screen 100 patients, and we met that mark, a little over 100. And so now, now the task is screening more than that this year. So,
wow.
Yeah. So bringing more education and awareness to the program is definitely a priority.
What are some warning signs that people may think that they have some issues that maybe they should come in or contact you guys?
So it's kind of just shortness of breath, with activity or with exertion. Again, just trouble breathing, naturally, even at rest.
Okay.
Chronic use of albuterol. You're not supposed to be using albuterol, 3 or 4 times a day.
Okay.
So if you're using that in excess, there's a problem.
There is a problem. Yep.
Come in and get screened.
Okay. And people this is a free test that you guys are doing, right?
It is.
That's what the funding is paying for too. I know sometimes people are afraid, with insurance. What happens with insurance if people have insurance? Do you take that too, or what happens? People can just come in and get this test.
Yeah. So if they fall within the grants, the parameters or the guidelines of zip code and area code, then to come in and get tested.
It's come in and get tested. Okay.
No, it's not just walk in and, hey, I want to get a lung test, but it has to be scheduled and and set up. But
because there's some stuff you have to do beforehand and.
Right. So there's criteria. So you can't, you can't, if you're a smoker, you can't smoke, 4 to 6 hours prior to testing.
Okay.
If you take inhalers, you can't do inhalers 4 to 6 hours prior to testing. No heavy meals. Stuff like that. So there's criteria that you have to meet before, instructions that you have to follow before you come in and get tested.
All right. Well, if you think you're having any issues, take advantage of this grant, the Edwards grant, and come into Heartland Health Services and have them take a look at you. Thomas Hinton, thank you so much for joining us. And of course, you can find more about Heartland Health Services on the web. You can find them at hhsil.com. Thank you so much for joining us.
Thank you.
All right. We got more coming up. Keep it right here.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.